Good afternoon, everyone. Thank you so much for joining today's Fireside Chat. My name is Jenny Bogard, and I am the Executive Director for the National Hypertension Control Roundtable. As you may have heard, we are recording this Fireside Chat, and we will be posting it on our YouTube channel very soon after today's discussion. I am so excited that we will be talking about how employers can prioritize hypertension control and management. And with that, I would love to pass it over to my colleague, Michele Bildner, who is a project manager at the CDC Foundation. Michele, the floor is yours.
Thank you so much. And welcome everyone to our session for the next hour or so, focused on how employers can prioritize hypertension control and management. We are really thankful that the National Hypertension Control Roundtable has invited us to do this. And so just thanks to everyone and everyone behind the scenes, especially. On the next slide here, I just want to share with you a quick disclosure about this work being supported by the government. And we'll get into it. So all the work that we do and all the work that we've done as far as the business case for hypertension prevention and control with employers is done through collaborative relationships and working with different subject matter experts and skilled individuals and organizations. And so we could not have done this work without the support of FTI Consulting Center for Healthcare Economics and Policy. And we have Kyi-Sin here with us today, representing that center, as well as Neil Goldfarb with the Greater Philadelphia Business Coalition on Health and his staff, especially over the last couple of years. Today is very special in addition because we have two individuals representing employer members of GVPCH, Lorna Haley, who is an occupational health nurse responsible for coordinating the health and wellness programs and managing all of SEPTA's monitoring and medical surveillance programs. And we'll hear more from her in a moment, as well as Jim Rhodes, who is the Deputy County Administrator for Camden County Government, with a lot of areas of responsibility under his leadership, but namely and really applicable today, that includes employee benefits and insurance. And he has a rich history under his belt as well. And for today's session, what I really hope that we can accomplish are a couple of things. We shared different tools and strategies with the NHCR at a summit in September. Was that 23, I believe, this past fall? If I'm recalling that correctly, we shared some of the work around these tools, but today we'll be able to share their full development as well as what it looks like to use these tools in practice. And we'll learn a little bit about what makes that successful and difficult and other things that employers are doing for health and well-being as well. So to turn it over for a moment, I want to let our employer participants tell us a little bit about themselves and their organization. So Lorna and Jim, if you could share a little bit more about your positions and your organizations for our attendees today, that would be great. Maybe we'll let Lorna kick it off, ladies first. Tell us a little bit about SEPTA and what your role is there.
Great. Good afternoon. It is with great pleasure that I have this opportunity to participate in such a critical conversation today. Again, I'm Lorna Haley, and I'm the occupational health nurse at SEPTA. That's the Southeastern Pennsylvania Transportation Authority. And we are a prominent transit system providing and just ensuring reliable and accessible transportation options for the Philadelphia region. That Philadelphia region includes the surrounding counties like Bucks, Chester, Delaware, and Montgomery counties. Our comprehensive services includes regional rail systems, buses, trolleys, subways, and a high-speed line. Furthermore, we facilitate smooth interconnections with various other transit networks like New Jersey Transit, PATCO, and DART. Currently, our workforce consists of about 9,887 employees, and we continue to grow. As the occupational health nurse, my primary objective revolves around prevention. I am dedicated to averting the onset or deterioration of chronic health conditions.
That's a big number of employees. I don't think I realized that. Thank you for sharing all of that.
You're
And
welcome.
Jim, what about you? What about Camden County? Oh, hey, Jim, click the mute button. Like, I know you have a lot to say.
I do. Um, I was just saying, like Lorna, I'm very pleased to be here and happy to be participating. Jim Rhodes, I'm a deputy county administrator, and I spent 10 years with Independence Blue Cross in Philadelphia before coming working with the county. The county itself is the largest county government in southern New Jersey with over 2,000 employees, many represented by labor unions. We have anything from laborers to accountants to police to lawyers, corrections officers, nurses, and other public health professionals, and a host of other disciplines. And ours is truly a diverse workforce in many ways, including gender, age, ethnicity. We are a 100% on-site workforce. We are not hybrid. We offer comprehensive benefits through the New Jersey State Health Benefits Program. And many of our employees are able to select a high-cost plan that's $10 a copay. So it's a rich benefit design, which causes opportunities and challenges in many ways. So we can talk about that.
That's great. Thank you. And before we talk a little bit more about how hypertension is affecting the current workforce, would you guys quickly share one example with our participants about something that was really successful or that in terms of health and well-being initiatives with your roles? Give us a little flavor of all the things that you might do in addition to hypertension. Lorna, I want to start with you.
Okay, thank you. So as coming from a clinical perspective, one of the things that I'd like to really brag about, one of the achievements, it's proposing on-site counseling services for our employees. We saw post-COVID-19 the need for more mental and behavioral health counseling, and we wanted to make it convenient for our employees. So we started this pilot program and had it on site 1 day a week, one counselor, which wound up going into 3 days a week, 3 locations, one counselor. Now it has just been approved in June from the board, early July from the board, that we can extend that program. And I'm so excited to talk about that because when we deal with the mental and behavioral challenges of our employees, that helps us deal with some of those chronic conditions and physical challenges.
Great tie-in. That's absolutely right. And Jim, what about you?
For Camden County, we identified a need in the workforce for a more direct contact to connect people to their benefits. And while not required by contract, well, the benefits are required by union contract. Outside of that, the county hired an organization called Ramp Health to provide on-site wellness coach services. The wellness coach works closely with our director of insurance, but she conducts office visits, in-person office visits for employees throughout the county footprint. We're all over Camden County, but she has office hours in the jail and the police department and the health department and county administration and everywhere else. We also conduct wellness fairs during open enrollment. wellness challenges for our employees, whether it's weight loss or it's step challenges. And we regularly feature wellness topics in our for our entire workforce through our employee intranet.
Great work. Thanks for sharing that kind of macro perspective and some of those sentinel examples, and also how hypertension control can intersect. And I'm sure there's more where that came from. So let's talk a little bit about hypertension then. Through this work and the FTI team, we've learned quite a bit over the last couple of years. And I think what is really interesting to me is that although employed adults tend to be younger on average than the US population, we still see hypertension affecting them in 3 out of 10 or 30%, which is higher than depression and diabetes. Not that we should stop addressing those conditions by any means, but really a both and. And so this is a great cause for attention for employers because this prevalence is quite high. Following the US trends of the population in terms of hypertension awareness, employees are in the same kind of boat where there's a good percentage, about 30% of them, of employees that are not even aware of their hypertension diagnosis. And so with that, unfortunately, there is only 35% do not have that hypertension under control either. So we have a lack of awareness and a lack of control among employers. So this definitely made it easier for us to really develop tools and really focus in on hypertension to make sure that employers can gain that awareness and then learn how to get control. Employers might see the impact of hypertension in terms of cost, specifically with direct cost. We're seeing that in higher healthcare specifically. We see 44% higher healthcare costs in individuals with hypertension versus those without. And if nothing is done, we'll continue to see this cost rise up to $25 billion in the next couple of years. And then the last point of cost, thinking about indirect costs, employees with hypertension have higher productivity costs, right? So we're talking about time away from work, as well as maybe presenteeism data as well. So we're seeing in the statistics where this indirect cost does actually drive business impact. So with your great work that you've done in benefits and health and well-being, what is your focus on hypertension, Lorna and Jim? Why is hypertension important for your population, for you to help manage?
Well, of course, for the obvious reasons you just mentioned, right? To reduce cost, to avoid additional comorbidities, because when with hypertension, and if it's uncontrolled, you have that associate with other comorbidities, which rises the cost even more, right? Also to increase productivity and reduce that absenteeism. But one thing that's really unique about the organization that I work for, it is I always compare SEPTA with the cardiovascular system, and Neil, you heard this before. So the company itself, it's so vital for the Philadelphia region and its surrounding counties. The company itself is that heart, that human heart, and the blood vessels. The human blood vessels, right? Those are all the transit lines feeding the communities, feeding other organizations and businesses in the community. So that oxygen and those nutrients that the heart pumps through that complex series of blood vessels, those are our sixth graders jumping on a train to get to school, our business owners, our teachers, our nurses to take care of people. So we're vital for the community. So having a healthier workforce and controlling and managing chronic conditions such as hypertension not only benefits the SEPTA community, it benefits the Philadelphia region.
Well, that's just a little pressure.
Sorry.
But what a such a no, I mean that's just such a beautiful way to say that. And you can really, we've been talking about employer health and how it does circumscribely, it does have a relationship on community health. I mean, Neil and I, we've been talking about this for a long time, and such a beautiful analogy to share that. And Jim, what do you think? Why is hypertension important for your workforce? Hypertension control.
You're on mute, Jim.
Sorry. I love Lorna's analogy also. It was great. Yeah, like SEPTA, Camden County is a service organization where, we provide services to our, 580,000, residents in all sorts of ways. And our employees, many who are front-facing as opposed to back of the house operations, it's important for them to remain healthy, and not just for the work they do, but for themselves, for their families. And we recognize that because we too benefit from that, speaking the organization leadership. While we're in the state health benefits plan, we're not able to examine claims as much as we would like. We don't get that data. We can verify the prevalence of hypertension in our population through reporting from our wellness coach, who she coaches over 500 employees annually, or 400, I should say, annually, or roughly 20% of our population. And that confirms that the prevalence is high, and we extrapolate that to understand that it probably just doesn't go beyond the people who see her. In fact, it could be higher because they're undiagnosed. We realize it has an impact on absenteeism and presenteeism, and in large part, due to hypertension. And just to give an impact of a potential impact on employees and the operations of the government, at any given time, 15% of our 911 operators are on intermittent FMLA status, which causes staffing issues, overtime issues, and performance issues. So we try to make sure we provide the tools and the benefits and the education that are necessary to help employees take care of themselves.
Great stories of impact from both of you. Thank you for what you do and for focusing on hypertension. And I think that what you're saying relates to work that FTI has done around this priority among CEOs. So I'm going to turn it over to Kyi-Sin to walk us through how to assess that cost and economic impact of hypertension.
Yeah,
Go ahead, and you want me to stop sharing now?
No, you can leave this slide up, and
okay.
I can share my some of the tools that we've developed as part of this project. But thank you so much for having me on this fireside chat. I'm happy to be here with Michele, whom I've worked with for a number of years, and then also I live in the Philadelphia area, so I'm happy to see Lorna, Jim, and Neil on the call too. Our work spans nationally, but I do understand what Lorna and Jim are talking about, as I am in this area and do take SEPTA to work. So as part of this work, we really want to focus on, what is a priority for businesses in terms of the wellness and health of their employees. FTI Consulting actually did a survey of investors and employees on what the priorities for CEOs should be. And for 2 years in a row, the survey has found that, investors and employees feel that the number one priorities for CEOs and their workplace should be that the physical health and well-being of their employees. So hypertension is a treatable condition, and it is a workforce issue, as Jim and Lorna has described. So the tools that we've developed here are really meant to help the employers get a better understanding of hypertension on their specific population. So, Jim had mentioned prevalence. There is, anecdotal evidence of hypertension potentially impacting productivity loss, but how much is it really impacting an employer's workforce? So the tools are really meant to, arm employers with information and data so that they can really understand their particular impact. So what I'm going to do now is share with you the budget impact model, which is a tool that employers can download from our website that Michele can put in the chat. But it's really an Excel workbook that's, everybody has Excel on their computers, so they can open it up and have a good an estimate of what the potential impact is on their population. It takes, 10, 15 minutes to go through this model. It's very easy to use, so I'll just go through it to quickly show what it can do for employers. So as I've, as you go through the model, there are multiple steps, but it's very quick. What's really important to note here is that all employers have a diverse workforce. So as Lorna is mentioning, SEPTA has an administrative staff as well as the transportation operators who are, in the front line, and different hypertension may impact different employee populations differently. So this model really takes into account of, looking at your employee population as a whole, but also really taking some of these factors into account. So, the first step is really, do you want to just analyze your population as a whole, or do you want to look at specific subpopulations as well? So I've just, as an example here, I've set two, I want to look at two populations. So I'm going to go through, there are some demographic characteristics that employers can enter if they know, but if not, no, we have a lot of default values that we've set in here using literature evidence. I'm just putting 5,000 as the number of employees. This is the only required data element that you need to put into the model. And here I've selected two populations. So I'm just going to go with a transportation example here. So my first group of employees is a transportation job function, and then I do have administrative job functions. And I put sort of the breakdown here as an example. And then you can enter the prevalence if you know it. As Jim said, they've extrapolated some prevalence, but a lot of employers may not have this information on hand. So there is literature evidence of different prevalence for different job functions. So I'm just using the default values here. And as you see, transportation, there's a slightly higher prevalence than the administrative support sort of job function employees. So that's what I'm putting in the model. I'm not going to enter data here, but if you do know the data for wages and absenteeism, you can really get a closer estimate that reflects your population, the more data you enter here. But I'm just going to go through it for the purpose of this demo. So, I just enter what I had there. And then this dashboard really gives you a good glance at, what is the potential prevalence of employees that are covered by the health plan with hypertension. And I've estimated here that out of the 5,000 employees, in total, about 800 individuals may be diagnosed with hypertension. And this is the incremental cost of hypertension for the total population. So this is the additional cost due to hypertension is about $4,000, and the annual cost for the workforce. And then here, there is more details on the specific populations here. So depending on prevalence and the wages, additional costs per employee under each function may be different. So if you click on the buttons, you get more detailed results that you can really get a good understanding of your population. So we've mentioned number of comorbidities. Yes, hypertension, we know hypertension, people with hypertension have a number of comorbidities, and the model provides an estimate of, the proportion of employees with one or more comorbidities, some breakdown of prevalence by demographic characteristics, and the cost breakdown here on the bottom. So this is, you can look at medical costs, pharmacy costs, productivity loss. So this is, productivity loss is not normally estimated through your claims data analyses and such, but here we provide an estimate of productivity loss costs and the total. And you can see here the difference between hypertension, those with hypertension and those without hypertension, and then the incremental cost there. Some graphs that project through for the next 5 years of without any intervention. So status quo, continuing the trends, the increasing costs and opportunity costs of not intervening on hypertension. So this tool is really meant to give employers with an estimate of the potential impact on their population. Some employers may have this data through, their claims data, but lots of employers don't have access to this specifically for hypertension at their fingertips. So this is really meant to do that. And data tables are also available if you're interested in specific numbers. So that's one tool that we have for employers here. Another tool is, that gives you a good estimate, but another tool is if, you want to dig a little bit deeper into your own claims data and see what really the costs are. And so this guide is meant to help employers answer some of those more in-depth questions on their employee population. So, for questions like how many employees have hypertension, what are the costs related to hypertension broken down by, different hospitalization costs, office visits, treatments, etc. And how many people are actually treated with medication for hypertension, and what is the adherence? So these are the questions that the model, adherence, the model won't be able to answer those questions, but you can really answer with this guide. And we also have this, how to use this guide. You may not have, some employers have access to their data, some employers don't, but you can use this guide in a number of ways. And you can have external partners run the analysis for you with the guidelines, or you can use it to inform future discussions with the payers to analyze your population for you. So these are the two tools that we've developed to really help employers estimate the impact of hypertension on their own specific populations.
Thank you, Kyi-Sin, for sharing that. I want to hear from our employers a little bit about using these tools, to what extent they were able to use them, and if so, what happened? Were you surprised by what you saw? Did it validate your expectations, or how was that experience? And I'll say Neil will talk about this as well. We provided these tools to a group of employers in a learning collaborative, and Jim and Lorna participated in that as well. So for all of you out there listening, please use the tools, but they were supported in a learning collaborative to kind of wrap their heads around this too. So what do you want to share with us, Lorna and Jim, about the budget impact model, for example? Lorna?
So, excuse me, we chose to go with the budget impact model tool. And I wasn't really surprised about the number per member per year, right? But then when I saw the huge number of everyone with the default values of those who may have hypertension within the organization, that was a big deal for me. And it took me back a little bit, so much so that I started teamsing, if that's a real word, sending team chat messages to our benefits department, who we collaborate with really well. And so now that budget impact model and the cost associated that we see, we're having these conversations now. So I am so happy to have the opportunity to use that model and actually see the cost per year. Amazing.
That's great. Jim, what about you?
Yeah, I have to agree with Lorna. It's I mean, we had an understanding of the potential impact and the prevalence of it through our wellness coach, and I wasn't sure how to use the tool, not having our data from the carrier, but you're learning that there is default data in there, and using some of the information from the wellness coach. Based on our population and a projection of $2.6 million, in costs associated with hypertension is eye-opening. And so while we're in the state plan and we pay a premium equivalent and can't really do anything to change the benefit design or whatnot, we're of the understanding that there's going to be a 15% increase for local government employers in 25. So we are actively evaluating our options. We potentially could become self-funded again, and this information will be extremely valuable to us going forwards.
And Jim, I was just putting in the chat too, this is a good time of year for employers to think about any changes they might want to start making as you get into fall and you're really planning to launch your benefits.
Mm-hmm. Absolutely. It is the right time of year to be doing this, because, not only do you learn numbers that will probably cause your eyes to open very wide, but as you're, trying to figure out what your benefits should look like going forward, you may find that this will have an impact on future budget years in a very favorable way.
Good strategy. I like that. Thank you for sharing. And so with using the tools, we hear some actions that you might be taking or thinking about taking. And that's precisely where our next tool is really helpful. And I'll pass it over to Neil Goldfarb to talk a little bit about this comprehensive benefits design guide and a little bit about that learning collaborative I mentioned. So Neil, I'm going to go ahead and advance to this next slide for you.
Great. Thanks, Michelle. And it's great to be here with Jim and Lorna, who are two of the 56 member organizations of GPBCH. So we are one of around 45 independent regional business coalitions on health around the country. We all operate a little differently, but I think at our core, we're all there to help employers keep people healthy and to drive value in the health benefit spend. I'm fairly old at this point, and I've come to believe that we can continue to push the healthcare system to offer better pricing, to drive appropriate care, but the best thing that employers can do to reduce costs and improve health is really be aggressive with managing and preventing disease. And so we in recent years have focused extensively on obesity and diabetes, and more recently on hypertension. And when Michele first started talking to me about what we were doing in hypertension, I said, right now we're not doing anything. Let me ask my members what they're doing. And it was pretty resounding silence that most employers in our coalition did not have any strategy to address hypertension formally. I think everybody knew hypertension was out there. They knew it was fairly prevalent. I don't think, as Jim and Lorna were saying, they really knew what it was costing them. And I don't know if they fully understood how much they could do to prevent hypertension and control hypertension. So what we ultimately did was we created our comprehensive benefit design, a guide for employers. And all of these tools, the ones that Kyi-Sin talked about and that I'm talking about, are all available on the web at the link that's included here. We encourage everybody to go look at them because I'm not going to have time to go through the whole thing in detail right now. There are a few things I thought, just to highlight a few things. One of the key recommendations is about primary care. Everyone should have a primary care physician. We should make sure those doctors are high quality doctors. And we should really be driving people to primary care because we know if there's one thing all docs do, even the docs who have some other quality issues, it's they all know how to measure blood pressure or they all record it in the record. So getting people into the primary care system, hopefully those docs then know what to do when someone has an elevated blood pressure, like advising on lifestyle change and prescribing the right drugs. So the second recommendation is really all around lifestyle change. Many employers already, and I think Jim and Lorna spoke to this, already have some sort of lifestyle change program in place. So it's really about making sure that hypertension is being discussed and featured in whatever you're doing with vendors, whatever you're doing with your own health fairs. Let's make sure we're measuring blood pressure, we're referring people with elevated blood pressure, and we're linking people up with primary care. Another set of recommendations is all about pharmacy coverage. We're big proponents of the work of Mark Fendrick and colleagues who talk about value-based insurance design. And many of the hypertension drugs, as you know, are fairly inexpensive, but even a $10 or $20 copay can have significant impact on adherence. The other recommendation is when we first started talking to employers, none of the people we were working with in our learning collaborative were looking at adherence data. And so one of our recommendations was, start to ask your vendors, hold them accountable to report on how people are doing with drug adherence in general and hypertensive medication adherence in particular. And finally, in benefit design, we did education for employers around blood pressure self-management and blood pressure self-measurement. And when we asked employers typically, do you cover blood pressure cuffs? The answer was, gee, I'll have to find out. So there are lots of things employers can do. And what we tried to do is make this user-friendly. The guide has resources if people wanted, as an example, to know, well, which blood pressure cuffs should I be looking at? They can go to the AHA link where AHA has evaluated all of the different blood pressure cuffs. So once we created the guide, we sent a message out to all of our 50+ members saying we're going to create a learning collaborative to review these tools and to hopefully help you implement a hypertension strategy. We started that at the beginning of this year. We had 10 employer members, as listed on this slide, participate in the Learning Collaborative. We're surveying them now after 6 months to find out what they've changed and if this was helpful. And one thing I can share with you, just a couple of quick highlights. When we asked people at baseline, what's your hypertension prevalence? Only 50% had a number. Now everybody has a number, at least everybody who did the post survey. So that's exciting. And the other thing is we asked you to commit for 6 months. Do you want to keep meeting? And all the people who responded said, yes, it's good to continue this momentum and keep meeting. So I feel like Michele and I and our colleagues are doing our job in helping employers, not only telling them what they should do, but helping them do it. And so we're excited about our work here.
Thanks, Neil. That's right. And Jim and Lorna didn't, necessarily plan for this, but anything you want to share about being in that type of environment with peer employers focused on a specific condition or topic? How is that experience for you?
Well, for me, it's absolutely wonderful because we get to learn what other organizations are doing. And we also get to brag a little bit about what we're doing. In terms of hypertension, before even looking at this tool, the strategy tool, I had to sit down and say, what are we doing at our organization, right? So we do have those grassroots things such as the health fairs. We have boots on the grounds going to different locations, educating our employees on the different resources that we have available in terms regarding hypertension. We also have a wonderful communications team that disseminates all of our resources on our SEPTA intranet, SEPTA Now. As far as lifestyle changes, that's in the book. We have Ramp Health on our property as well. We have a wellness coach. We have registered dietitians on the property addressing lifestyle changes. But one of the things that I didn't do as the occupational health nurse, which I'm doing now, is working a little bit more closely with the benefits team on the pharmaceutical coverage. One of the things that I learned that our wonderful benefits department has done, they've worked with CVS, and they have now, with under the CVS umbrella, something called maintenance choice programs. So our employees that are prescribed maintenance drugs for hypertension, maybe, or any other chronic health condition, they can pay a copay, and the copays are pretty minimum, between $10 and $20 a month, but they'll get this 90-day supply through this maintenance coverage program for the cost of a 60-day supply, which I thought was great because there is a savings with that. As far as working with the CVS, trying to promote more combination drugs with hypertension, we have to talk about that, because we do know that people are more compliant when they can take one drug opposed to two. And then a lot of those combination drugs is known to have a certain synergy. They work a little bit better sometimes when they're together. So we're working on that. And I'm so grateful for that collaboration that we have with the coalition.
That's great. And like you said, collaborating internally with benefits. And Jim, that's a great segue to you.
I find myself agreeing with Lorna and Neil. The collaborative really was eye-opening. We had the wellness coach on staff on site already. But now I was able to sit down and discuss with her and our insurance director, and have a conversation about how are we focusing on hypertension? What are the tools that are out there? Also with our broker, and with the in challenging our insurance department, what are the benefits that are available through the health plan, and how can we better promote them to our employee, make them more visible to employees who really normally, look at their benefits card, and that's about as deep as they look with regard to the type of coverage they may have. Our wellness coach provides weekly blood pressure monitoring at sites around the county. Employees are provided with a blood pressure tracking card, which they can take to their physicians, which helps in monitoring for the effectiveness or the need for medications, creates awareness. We can catch hypertension early, which is easier to control, especially with early intervention. We provide health education materials to employees on the importance of healthy blood pressure and the ways to achieve it. The coach also provides educational materials on the causes of high blood pressure. At the last update we had from our health coach, 73% of the employees that she sees that monitored for blood pressure had their blood pressure go from a high risk to a lower risk category. So that was very, very encouraging to see. We also provide details regarding the benefits that are available through the health plan. I said that already, but all this information is available, and we have a health, wellness, and benefits site on our employee intranet page. So we try to make sure employees have access to all sorts of things through the county government, but we focus health topics on the homepage at least weekly. Recent topics have been benefits of cardiovascular activity, heart disease, know your numbers, body composition, cholesterol, triglycerides, but also managing your blood pressure. And we promote anything we're gonna, or I should say, we coordinate anything we're going to promote with our wellness coach. So as we have it on the website, she's talking to the people she's meeting with to let them know, hey, get more information here and all that. So we're very focused. It's a never-ending battle, but every time we reach somebody, we feel great about it.
Thanks, both of you. Lorna, go ahead.
May I add one more thing? And thanks to Neil in this collaboration as well. One of the things, Neil, I didn't get to tell you, but I'm telling the whole world, we just purchased blood pressure cuffs.
There you go.
We just purchased some. So that's one more thing that we can do to help manage hypertension. So thank you so much.
Fantastic news. Neil was saying he thinks we did our job. I think continues and continues. That's fantastic news. But for both of you and Jim, also the timely, posting of health education information related to cardiovascular and hypertension. So great for both of you. I want to lean in just a little bit here with the time we have left. With I'll say the guardrails or guidelines that you have to follow with your benefits plan, Jim, especially, what is it that you think payers could benefit from knowing from an employer perspective? What is it that we, could share with payers about data or sharing metrics? What is it that would help make your job easier? Say that.
And having been with a carrier in my previous life, I think they know, and that's not a dig, but more claims information and analysis is better than less. That should be shared with the employer, and there should be a conversation about what it means and how it can be used to better improve our population health, and to whether that's through making sure we're aware of what they have so we can promote it, such as coaching or nurses, but that should be coordinate with the employer. Things may go out in the mail to members that we just don't know that's happening. We can certainly magnify the impact of their messaging by doing some on-site work ourselves. So some better coordination of that type of information would be very helpful.
Great add. Neil, anything you would add to that from listening to employers and thinking about the payer perspective and the employer perspective, how to better merge those?
Yeah, no, I think Jim and Lorna did a good job with that. What I'll say is, I hope the people listening in today can appreciate our employer members. They all really care about their populations. They're all really stressed. Think about everything that has to be managed. So when we come to them and say, well, you should also be looking at hypertension, or what are you doing about mental health? Or it's a long list of things, and I really appreciate it. Does my heart good when I hear about well, we changed something as a result of this education. So Michele and I are continuing with Kyi-Sin to we sort of created our road show around the country, going to other coalitions. For those of you listening in today, as I said, there are around 40-something coalitions. So if you're not familiar with, does your region have a coalition? We're happy to answer that question for you or point you towards the National Alliance of Healthcare Purchaser Coalitions. And you can link up with your local coalition. But we're really trying to raise awareness for employers that there are things you can do, like, yes, Lorna had to get approval for budget to buy blood pressure cuffs. But in relation to the cost of hypertension, the blood pressure cuffs are a really low cost intervention. So why aren't you doing that, right? So it's all about how we educate and communicate and make things easy for employers.
I like that, Neil. And Jessica has a question about, is there a Denver coalition or Colorado coalition? If you want to respond to that. And I think, as we've been taking this show kind of on the road, as Neil said, Kyi-Sin and I and him, these key takeaways are starting to be even more and more salient. And certainly Jim and Lorna have shared that. But talking about investments in long-term outcomes versus the cuff will cost, this per unit, when will I see the return? This idea of really investing in hypertension prevention and management will result in an investment in your business. And we hope by taking this on the road, employers will learn that hypertension is treatable. It's a hidden risk. There's ways to assess that risk. There's ways and strategies to put into place that can help mitigate that risk. And those, of course, are the tools that we shared with you all today. And so how can we make decision-making easier for employers? This is hopefully one example of that. And always keeping employers in mind when we design the tools, as well as we're sharing the tools out. I put this in the chat, and at the beginning of our presentation, we took many steps to make sure that tools were somewhat co-created. So Kyi-Sin, Meg, who's on today, and the FTI team, and working with the National Forum, who I know is a member of the Roundtable, and et cetera, really keeping that close, and the design was really important to all of us. I think the last thing, just to reiterate, especially for folks who may have joined, I know folks are starting to leave, but those who may have come at a different times in the beginning, all of these tools are located on the NHCR website. If you click over to the resources tab at the top of the website, you'll see a suite of tools, including infographics for helping communicate about this investment, as well as the budget impact model, the claims analysis guide, the comprehensive benefits design guide, and then the budget impact model user guide. And if I missed anything, go there, check it out, and let me know. But that's it from me for today. Want to see if there's anything that Jim, Lorna, Neil, or Kyi-Sin want to share before we open it up for any questions and answers through the chat. Anything else, team?
The only thing I like to say is just thank you, and please continue, everyone on this line, to keep up the great work.
Yeah.
I also wanted to say thank you, and encourage everybody to make the investments, and also realize that they may not result, in immediate, satisfaction. Healthcare costs are going to go up next year. But what we can do by making these investments is to, focus on our employees' health, and to make sure our workforce is the best it can be and as healthy as it can be, which is good for them and for their families. And eventually that will impact cost, and benefit everyone.
Love it. Well said. Jenny and the Roundtable team, we'll turn it over to you to help us moderate any questions or chat. I'm going to go ahead and stop sharing for a while.
Thank you all.
Thanks, everybody.
Thank you all so much. This has been fantastic. And I just want to reiterate what Neil had said a few minutes ago. There are so many competing health priorities, expenses, and I really think this just reiterates how important data is, because once you have the data, you can make those decisions. And I think to what Neil said, that once you see the expenses of uncontrolled hypertension and how it affects your employee population, it's natural to want to act on it, right? So kudos to all of you. Thank you so much for the great work that you're doing to prioritize your employees' health. Thank you, everybody, for attending today's Fireside Chat. I don't see any questions right now. There was some comments going back and forth, but I hope you all enjoyed today's Fireside Chat. We will be posting this on YouTube on our channel in a few days / weeks maybe, and then I hope you all join us again for our last Fireside Chat of the series on July 31st, where we'll have the Academy of Nutrition and Dietetics talk about their latest research that they just published on nutrition, the benefits it has with hypertension control. With that, I hope you all have a wonderful summer. Thank you again to our wonderful panelists, and keep up the great work, everyone. Bye-bye.